Hi, my name is Rakeen, and today we'll be talking about World Neglected Tropical Diseases or Disease Day, its impact and significance in Malaysia. So, World Neglected Tropical Disease Day falls on January 30th for 2026. So, raising awareness of tropical diseases affecting Malaysia. So, a few agendas today. Firstly, understanding neglected tropical diseases or NTDs. World Neglected Tropical Disease Day, a bit of the background and objectives, the burden and impact of NTDs in Malaysia, and Malaysia's response and progress in tackling NTDs. So, understanding neglected tropical diseases, NTDs. So, NTDs, neglected tropical diseases, are communicable illnesses common in tropical and subtropical regions, mainly impacting low-income populations. So, for an example of NTDs are dengue, lymphatic filariasis, schistosomiasis, and soil-transmitted helminth infections. So, NTDs cause chronic disabilities, stigma, and reduce quality of life for millions globally. So, this is some of the major listed neglected tropical diseases under the WHO, World Health Organization. So you have Buruli ulcer, which is like chronic infection or chronic skin infection transmitted by mosquitoes. We have the dengue, which is a virus transmitted by mosquitoes. We have rabies, fatal viral infection that attacks the nervous system. Scabies, which is a skin infestation by mites. Leprosy, which is a curable chronic bacterial disease. So, global prevalence and affected populations. So, neglected tropical diseases affect over 1 billion people globally, primarily in tropical and subtropical regions, and rural communities, urban slums, and marginalized groups with limited healthcare access are most affected by NTDs. So, NTDs contribute significantly to disability adjusted life years, emphasizing their burdens on global health. So, why are these diseases considered neglected? So, neglected tropical diseases have historically received less attention and funding than major global diseases such as HIV/AIDS and malaria. And these diseases predominantly affect impoverished regions with little political influence or advocacy. And the stigma around NTDs and their chronic symptoms contribute to their low global prioritization. So let's look into the background and objectives of the World Neglected Tropical Disease Day. A bit of the history. World NTD Day was established in 2020 to raise global awareness and promote coordinated action against neglected tropical diseases. And the day encourages governments, organizations, and communities to close the treatment gap and intensify efforts against NTDs worldwide. The World NTD Day commemorates the 2012 London Declaration, which renewed global commitment to control and eliminate NTDs. So the Observance Day raises public awareness about neglected tropical diseases and their impact worldwide. It encourages investment in research and develop new treatments and innovative solutions to combat these diseases. Focus on empowering affected communities to reduce stigma and improve health outcomes. And lastly, the day highlights the importance of partnerships and political commitment to sustain efforts against neglected tropical diseases. So, what are some of the international efforts and partnerships? So, the Global Health Initiatives. WHO's roadmap and London Declaration illustrate strong international commitment to combating neglected tropical diseases. and the partnerships between governments, NGOs, and pharmaceutical companies enhance resource sharing and program delivery worldwide. Mass drug administration, surveillance, and innovative diagnostics drive improved treatment and disease control outcomes. Now let's look into issues or the burden and impacts of NTDs relating to Malaysia. So most common NTDs affecting Malaysia. Malaysia faces NTDs including lymphatic filariasis, soil-transmitted helminthiasis, dengue fever, and leptospirosis. NTDs are prevalent mainly in rural and underserved areas where healthcare access is limited. Dengue outbreaks cause significant illness with varying prevalence linked to environmental and social factors. What about the health and social and economic consequences? NTDs cause long-term disabilities and disfigurement, severely affecting patients' physical health. Regarding the social stigma and mental health, affected individuals face social stigma and mental health challenges due to visible symptoms and societal attitudes. NTDs reduce workforce productivity and increase healthcare expenses, especially harming low-income communities. And these diseases perpetuate poverty by causing lost educational and economic opportunities over time. So who are the vulnerable communities and at-risk groups? So we talk about at-risk population groups first. The vulnerable groups include indigenous people, migrant workers, rural poor, and urban slum dwellers exposed to multiple health risks. And regarding challenges from poor sanitation and vector habitats increased health risks for these communities, contributing to disease spread. And the lack of healthcare and preventive services heightens vulnerability and worsens health inequalities. So what is Malaysia's response and progress in tackling the NTDs? So government initiatives and public health interventions. So firstly is the mass drug administration programs. So Malaysia's health ministry runs mass drug administrations to combat lymphatic filariasis or elephantiasis effectively and reduce disease prevalence. Then there's a vector control for dengue. So vector control initiatives target mosquito populations to reduce dengue admissions, especially Aedes mosquitoes, and to protect public health. Regarding sanitation and community education, improved sanitation projects and community education help prevent disease spread and promote healthier environments. And the national strategies aligned with WHO's NTD roadmap, emphasizing surveillance, case management, and ongoing monitoring. So the role of non-governmental organizations and research. So NGOs enhance healthcare access and conduct awareness campaigns in remote communities, supporting government initiatives effectively. Capacity building efforts. NGOs focus on capacity building to empower local communities and improve sustainable healthcare delivery. Regarding research driving innovation, academic and clinical research institutions innovate diagnostics, treatments, and epidemiological studies to inform health policies. And policy and public health impact. Research findings guide public health strategies and policies to improve control of neglected tropical diseases, NTDs. So about the success stories, challenges, and future directions. Malaysia has eliminated lymphatic filariasis in many regions and successfully reduced dengue fatality rates through effective health interventions. In addition, they also mention regarding leprosy, which they have successfully eliminated majority of the cases in the 1990s. And ongoing challenges: sustaining funding, combating vector resistance, and reaching marginalized populations remain critical challenges in disease control efforts. And for the future strategies, future focus includes integrated disease management, innovative vector control technologies, and strengthening health system resilience. So, in conclusion, united efforts to overcome neglected tropical diseases in Malaysia. Firstly, we have ongoing health challenges. Neglected tropical diseases continue to affect health and economy in Malaysia, requiring urgent attention and action. Secondly, awareness and advocacy. World NTD Day promotes awareness, mobilizing public and private sector involvement in fighting these diseases. And lastly, collaborative initiatives. Governments, NGOs, and researchers collaborate towards reducing disease burden and improving vulnerable community health. Thank you.